Hello. Hi, my name is Adelene Cheong. In today's conversation and guided practice, which I offer weekly, I'd like to share with you the topic on how to alleviate and manage back pain. Hi, Sarah. Hi, those of you who are just logging in, joining the live session. So firstly, I'd like to say that when we talk about back pain, what does it actually mean? Back pain is something that it's common. We hear it more and more commonly now, whether it's back pain, lower back, upper back pain, shoulder pain, neck pain, basically anything that's uncomfortable along the back body. And it's not helping with a lot of sedentary lifestyle and also lack of movement, that the body needs to move. The body needs lubrication and juicing and movement to stay integrated, healthy and supportive. Hi, for those of you who are just joining, I was just explaining that back pain is getting more commonly heard in across all culture and traditions or countries. So firstly, I'd like to explain a little bit more about pain, the word pain in itself. When I first experienced back pain, which I've probably the first episode I've experienced back pain was during my late teens into my uni days, where there's a lot more sitting, there's a lot more just studying and reading, looking down at books and all, a lot more sitting, hours of sitting. That's where I first experienced ache and pain that I couldn't describe at that time. It was like just uncomfortable sensation in my body, and it's very depleting, especially when it's there all the time, or probably at least it recurs every so often. It's really tiring just to move around or stand up or go about my day. So I didn't really understand what back pain is, or what is it actually telling me, what does it mean. And that's why I was really interested in exploring this area of back care, spinal integration and spinal work over the years of when I come to yoga. And yes, plus scoliosis, which is an asymmetry imbalance in the body, which I discussed last Tuesday. For those of you who are interested to know more specifically about scoliosis, you can refer to the recording, the hour-long recording where we had a conversation about scoliosis last week. But specifically now I'd like to talk about when I experienced back pain, I didn't know what it was, what it actually means, what's asking me to do, how to respond. Is it to take another painkiller or to put some injection? I know there's lots of other treatments that was offered at the time to deal with pain and discomfort in the body, especially along the back. So firstly, I was really interested in knowing like what's actually happening in my body. Is it falling apart? Is it just postural? Is it something that I'm doing that is not helping the situation? And firstly, I'd like to say, what is pain? Which is the question I initially asked. What is pain? Pain, now that I've really have a more positive relationship with this term, is that it's simply a sensation, a heightened, intense sensation that we tend to want to push out and want to avoid because it's undesirable, it's unpleasant, it's achy, it's depleting. And if I say that pain is basically a sensation, which is what is sensation now? Sensation is the main language between the body and the mind. So when there is a sensation in the body, whether that is just a pinch or a sudden sensation that is being flicked on the skin, or probably hot, cold temperature, or a spasm. So these are different things that the body experience through pressure, through contact, to recognize that, hey, some information is coming in through the sensory receptors of throughout the body on this external surface and inside, detecting this information and then through sensation to the brain, saying that, hey, there's something here. What is it asking of you? What is the information offering me in that moment? Is it asking for me to rearrange my position in that situation, or wherever I am? Or is it asking me to rest it, lie down simply, or to massage it, or to rub or massage it? And basically, to me, sensation is the body showing up some information. Now, whether you take any action, how do you respond, react to that sensation and that piece of information? That's the question. How do we deal with, how do we understand whether the sensation is to be negotiated, or is the sensation simply offering me some information for future reference or my positioning in that moment? So it's really important that we pay attention when there is a sensation that is showing up. So let's kind of dissect this a little bit. So right now that you are across the screen from here, if there is any kind of unpleasant or discomfort in the body, how probably where is the location is this of this intense sensation, if any? So some may say the hip, some may say the upper shoulder into the neck, or lower back. Where would be the location of the sensation of discomfort, or you can call it the pain that you experience? So for me, one of the areas that I tend to notice discomfort is my lower back, but only on one side, like mainly on my left side lower back. And the location is also really helpful, because that tells us also whether it's near a joint, near the two bones, like where the two bones meet, it's a joint, or is it more across a bundle of muscle, or is it deep inside the organs? So someone say hip area, Ali. Yeah, hip area for you. And sometimes I might notice a sensation along the upper neck right into the base of my skull. Now what does that mean, and how often does that happen, and is it sharp, is it localized? So that's let's look at, so lower back, same as you, more on the left side. Okay, so more on the left side for you, deep inside the hip area, generally the concave area in the lumbar region. Okay, so the small of the back, kind of the small of the back. Trapezius SI joint specifically, yeah, trapezius, Stephanie was saying, of the upper back into the shoulder blade muscle. And SI joint, very specifically, SI joint, it's quite localized. You could probably pinpoint with like one finger across the back of the pelvis. Now, the first thing when I talk about sensation and in terms of its location, are you able to point to that area with one finger, or is it like across a big area that you need to use your whole hand to kind of like around there, or is it around the lower back area? Or is it like very localized? I can feel it right in there, inside the hip. So if it's a one finger kind of localized area, tends to be, is non-negotiable. It's often referring to a joint, misalignment or fracture, or it's a very localized, sharp, usually sensation. It's non-negotiable because it could be also the nerve thing, a nerve, like impingement of the nerve, or a pull on the ligament, which is very specific, that you can almost pinpoint with one finger. So those sensation, firstly, if you locate the sensation and it's somewhere that you're able to pinpoint with one finger, it's very specific, that is non-negotiable. When I say non-negotiable, meaning you may need to completely maybe change position, come out from what you were doing a moment ago, or the activity or movement that you have been engaging with. And yeah, reorganize yourself in order to alleviate yourself from the discomfort. Usually that by changing orientation, position, the localized sensation may shift. Most often it will shift in that moment. It might come back, but it's just that by changing shape and orientation and position, it might immediately have a different sensation in the area. So just noticing that. Now, whereas some of you might be thinking, yeah, what about me, which is across a bigger area where I feel it across the whole of my upper back, shoulders, or across the lower back. Whole hand inside the hip, yeah, it's deep inside. So that also often referred to, like, you can literally feel it's localized in the hip joint. But often pain is tolerable. Skin condition causing itching much worse. Those still just a sensation. Yeah, so there are some sensations which are pretty much neutral and giving you some information of maybe just dryness, therefore itchiness, or is it sensitivity to the environment that it's giving you that information. Occipital pain coming down the left side. Yeah, okay, so at the base of the skull coming down the left side. Yeah. And if it's generally across a bigger area where you almost use your whole hand to refer to the area, more than likely that points to a bundle of tissue or muscle that is tense or tight or contracted. Because muscles, fascia, layers of this thick tissue often present themselves as a bundle that attaches between 2 points. So between my wrist and my elbow, this would be relatively long piece of muscle, but I will have to refer to it like this rather than like in there, right? So if it's the lower back area, if I'm referring to my lower back area here, I use my whole hand. And firstly, the location of it, it's not near any bones. It's really the spine in the middle, the ribs a little bit above it. And I kind of ruled that out, that it's probably not a joint thing, but it's across a layer, deep layer of tissue that is hardened or restricted or almost difficult to breathe into because it's so compressed and restricted. And usually I would say if the sensation or intense sensation, strong sensation in that area is across a bigger bundle that you can almost like use your whole hand, right? That is usually more negotiable, meaning we could probably breathe through it, maybe gently palpate it or massage it and negotiate some elongation of the tissue, making a little bit more breathable space in the area, rather than before a moment ago when I said if it's a localized area is non-negotiable, then we'll have to literally change position, come out from where you were or in that within that movement. So just recognizing what's your experience in your body right now, and whether that is something that is acute and just on off, or is it a chronic discomfort that has been there, often there, almost a daily occurrence. So the frequency of it happening it's also a consideration. So some of the things that I would like to know when I work with a student therapeutically is to know, are there certain positions that only trigger that discomfort, or is it like in any position that it's always there and it often recur in the same area on a more daily basis, a regular basis? And those information tends to help us understand a little bit more about whether it's postural related, or is it literally in the joint, or a nerve impingement. So let's see, are there any comments, question about what I've just said? Like, that's just lots I've just said. Before we go a little bit more into sensory intelligence, I've just basically a moment ago, for those of you who are just joining, a moment ago we were discussing what does pain mean and how do we locate or understand pain. There's a little bit more to that I wanted to say, but just checking in with everyone. So when there is a discomfort or pain, quote unquote pain, it's often the body. Yes, I said it's a language between the body and the mind, but it's often the body informing that there is something that is imbalanced or dysfunction or misused, abused, overworked. Something is out of harmony or in sync with the rest of the body in terms of posture or movement. And it could be a discrepancy between upper and lower body engagement, and therefore the strain in the body. Or it could be a left and right side if you're feeling it more on one side, not the other. Or it could be an imbalance or dysfunction between the front and back body, right? So if you feel it more in the lower back across both left and right side, then I would more likely guess that it's an imbalance of engagement between the front part directly in front of it, which is the abdominal wall and abdominal muscles, and the lower back front and back engagement. So basically there's an imbalance activity or engagement when there is a strain experience in the body. SI joint pain in the student, yeah. SI joint pain is literally, it's a joint pain. It's the position itself determines. It's really about the repositioning, the pose or the movement. Yeah. It's a whole workshop on SI joint pain. So I will only say that as much as it's about reorienting and repositioning the pose, than trying to stretch it to relieve it. It doesn't relieve by stretching, because that's more the ligament that is trying to stabilize the SI joint and pelvis. If anything, around the pelvis and sacroiliac area, it requires more stability than mobility. So let's backtrack a little bit. I wanted to talk a little bit about sensory intelligence. What does it mean? Is to be able to probably have this sensitivity to be able to pick up and decipher and interact with sensation that is arising from moment to moment. Because moment to moment, with this inhalation, with the next exhalation, sensation continue to fluctuate in and out. Intensity may slightly rise and fall depending on from moment to moment or position that we assume. So sensory intelligence is also helpful, at least to initially cultivate, by describing to yourself how would you describe that sensation in your body right now. So yes, it maybe start with the intensity of it. Is it maybe some vocabulary that I would share with you is whether the sensation that you're experiencing, if you were to describe it with words, is it tight, restricted, knotted up, like knotted, spasm, sharp, hot, cold, spacious is also a sensation, like you feel the sense of like openness and spaciousness. Maybe stickiness or adhesiveness is like gluey in that bundle of tissue and experience locally. There might be very adhesive, yeah. Or is it more of a dull niggle ache in the body? So just noticing, like right now, where you experience, if there is any discomfort in your body, or firstly the location of it, and then how would you describe that? What are the words you would use to describe that intense sensation? Lisa, hi for those of you who are just joining. And sometimes it could be maybe more of an inflamed sensation, or kind of swollen sensation in the area. So just noting the description of the intense sensation is one that may tell us then a little bit more about whether that, again, it's a muscular thing that is negotiable, or it's something that is to be avoided, or to change, rearrange, reorganize the body position or posture. And just a quick word about acute and chronic is that, especially with acute is something that usually happen in a shorter term. And in the medical description, when I was researching years ago, it's about anything that is intense with less than 6 months recurrence, or probably less than 6 months within the experience of discomfort. Chronic is something that can drag on for a long time, which is really depleting for me in my experience when there is chronic pain, which is usually more than 6 months. That's roughly the timeline. But for me, when I think about chronic discomfort or pain, I'm suspecting, and most likely, that it's because however much I relieve and stretch and elevate the discomfort or spasm or constriction in the part of the tissue, that some part of my daily movement or posture is encouraging or repeating that habitual movement or pattern in order to continue experiencing chronic sustained discomfort in the body. So just then we'll have to talk about locating if there are any specific movement or patterns or posture on a daily basis that is bringing on that discomfort or pain that is recurring and therefore chronic in the experience. So just noticing that. Okay, pause, take a moment. Now, a small part that I want to talk about, how it relates to emotional and mental stress and back pain. We hear about it a lot, that people say that back pain is often a result of, or probably at least brought on by stress. The thing is, when there is slightest imbalance in terms of engagement, activity, functionality of the postural muscles or back muscles, when there is even the slightest, maybe a weaker side or probably a more sensitive area that it's susceptible to straining, when we experience stressed, whether that is coming from the outside or the inside, or mentally or physically challenged, stressed, the body releases a biochemical to contract. Some part of the body will have to contract in order to experience or probably to activate the stress response. And when things get contracted and kind of compact and restricted, more than likely it's gonna contract asymmetrically, or probably in a way that those weaker area or more susceptible area or more likely to be strained area would probably experience it more quickly or sooner than other parts of the body. And therefore, the first thing we often notice is the same area that is recurring when we experience stress and intensity of sensation, whether that's coming from physical stress or mental emotional stress. So just take a moment to notice where is your weakest link, which part of your body that often pain or discomfort shows up most regularly or repeatedly. And that might help you notice or probably give more attention to how to work with or to release or to pay attention when there's the slightest increase in, even just increase in tone and tension before it escalates into pain. So there's an escalation process. Initially, it might just be some tightness or restriction, and then eventually, if left alone and not attended to, that it might gradually becomes more of a ache, and from aching then it might escalate into pain and chronic pain and on and on. So just noticing how is it showing up, how do you describe in terms of its texture, quality of the sensation. Recognize that when there is a pain, the body is simply asking SOS, asking for help. How are you gonna respond, react to the information that the body is showing up and offering you in that moment? So those are a few things that I wanted to share with you in terms of understanding this intense sensation in the body, which is most often people would say that is undesirable or unpleasurable. But to me, I think ultimately there is a place for it. There's a place for pain because it's showing up so that I know, so that I can respond appropriately or reposition myself to find a more healthy, integrated support or movement. So it's not all bad about pain, but more so that how do you use the information, but that when that comes through, before it escalates into a very depleting situation. So build up your sensory awareness, sensory intelligence, so that becomes something that you will notice at the very first sign when it shows up. Yeah, so that's the first thing. So before I get into some suggested practice, I'm going to offer today, in terms of practice, a few positions which is very accessible. You're not going to need any props, any bolster or yoga props or special location to actually do this. Very accessible, where you can do it at home, in the hotel room, traveling, at the airports. It's just anywhere you can find some furniture or the floor and the wall to help you release your back. But of course, I'd like to qualify that this would be appropriate more so for muscular tension, or at least in the tissue, rather than a joint issue that causes the discomfort and back pain. So if it's something that you experience that is more of a localized, acute sensation in the body, just move and experiment with the position with really small doses and with great care, so that you can modify or decide to come out from the position if you need to in that moment. Yeah? And it's all about the breathing as much. So when you're in the position, we are not attempting to stretch or to pull the body in a different direction, shape or form, but simply allowing a little bit more breathability in the area of restriction or contraction. Okay, so any maybe comments, questions before I move away from the screen and demonstrate, and you'll be able to, you're invited to practice with me. Like I said, you don't need a lot of props, but I do have a carpeted floor behind me, but if you're on a wooden floor or quite a hard surface, then just have some padding for you to lie down on, whether that is just a stack of towel or a yoga mat, in order to cushion your body. Hi Chancy, hi Latasha, hi Maggie Jun Lim, Katie, Joe, hi, thank you for joining. We're about to go into practice now. Are you ready? So there's a question here. If you're ready, just give me a thumbs up so that I know how many people are like with me going into practice. Can any pain be positive during the practice? How to know the difference? Yeah, okay. So firstly, right at the beginning of this conversation, of course, some of you who have just joined, you can, it's pre-recorded, so you can just replay the thing, the conversation at the beginning. But just a quick answer to that: how do you know if the pain is to be endured or to be avoided? Firstly, go slow and go in very small increment in terms of whether you are stretching it or the range of movement or the flexion and extension of the position. Go slow so that you can notice the first sign of strain. So yes, we want to work with, we want to engage or maybe stretch or elongate some tissue, but not straining. So if you're noticing the first sign of like undesirable strain in the body, then that's the point where you want to take a moment to back off and notice if it's healthy to move into it, to negotiate and breathe through it, or to completely change another position or orientation for practice. And you could probably decipher that by first the location we talk about at the beginning, the location of the sensation, which is helpful, whether it's one finger, localized area of discomfort, that is to be avoided. If it's across a bigger area, which is kind of a bundle of tissue or muscle, that is generally more negotiable, where we can probably breathe through it, stay a little while longer for the tissue to slowly change in texture and tone. So okay, now I'm gonna start with demonstrating right behind me. I'm gonna use I'll show with the wall, as well as I'll show also with a couch that you have. It could be a dining chair, it could be a side like sofa that you have, or even the side of the bed that you have. It doesn't need to be a high wall or something, but I'm gonna show both ways so you could see. I'm gonna show 3 things today. One will be lying, 2 will be lying on the back, 1 will be lying on the front. So obviously lying on the front or lying on the back, if this doesn't work for your experience in your body, then please do just watch and see how that goes before you decide if it's appropriate or how much modification is required or needed in order to do a little bit of postural release with this practice. Okay. So firstly, I'd like to say that I'm gonna lie on my back and get my legs as close as possible to the wall with knees bent. So I'm gonna squat my sit bones or my pelvis right up against the wall. And if you have your camera or probably at least a device next to you, you can just do this with me as long as you can still see me. So what I'm doing is I'm putting my feet on the wall so that it can keep the shape of flexion. And because I have the floor behind me to give my full support on my spine in flexion, I can just stay here and hang out here for as long as I need, allowing gravity, allowing the flat firm surface to help release any postural tension along the back. So this could be it. You can stay here for as long as you need. And gently begin to also notice the difference in contact pressure against the upper back, mid back, lower back, or maybe even between the left side, right side, the right and left side of your upper back, the left and right side of your pelvis, lower back, and allow gravity to unravel, to dismantle the restriction or tightness, tension along the back. And it's just one breath at a time, softening, releasing. It's okay even if your pelvis come off a little bit initially. Just have something to rest your feet on. Now you can do the same. I just want to show an option. You can do the same with your feet against the edge of a chair or a sofa. Of course, the closer your pelvis is to the wall or to the sofa, it's going to be a little bit more stretch, a little bit more opening along the whole posterior chain. Maybe just take another minute here to experience how breath by breath that we are allowing the flat, firm surface beneath you reorganize tension by having different points of pressure against your back. And that is also modulated by your breath. And if you're noticing anything that's coming up into the shoulders, just notice how you could consciously release and drop the weight of your shoulders. Really just dead weight, let your body fall back. The tiniest rolling the head, neck from side to side. Doesn't need to be a big movement or stretching. It's just a tiny, just loosening any holding patterns along one side, maybe of the neck more than the other side. So just a loose rolling of the head, and rest the head in the middle most of the time. And maybe just for a few more breaths before we take this into mobilization. So wherever you pay attention to, that's the area that the mind's talking to, that your breath is referring and talking to, communicating with. So as you consciously drop the heaviness, the weight of your pelvis and lower back, just notice how it gradually softens with each breath, the heaviness of it. And as you take your attention, awareness to the upper back, near the top of your shoulder, back of your ribs, back of your chest, notice as you exhale how you could also drop and let the weight fall back. Let the weight of your head fall right back. Resting. And now from here, of course, this position you can easily stay, hang out here for as long as you need and feel complete on its own. But I'd like to offer you another movement that could potentially mobilize and loosen any grippy constriction, especially in the hips, lower back, and sometimes into the mid back also, which is more of a windscreen wiper leg movement. So you can simply push away from your sofa or your wall now, and lying on your back with your knees bent. Have your feet hip width, if not a little bit wider than hip width. And hands on your belly. Allow the pelvis, I know it looks like my legs are moving, but it's really, I'm really rolling and pouring the pelvis over to one side. So I'm really feeling the weight sinking into my right pelvic half now. And then slowly coming back to center and slowly shifting the weight across the terrain of my sacrum, back of my pelvis, into the left pelvic half. So I'm really sensing into the heaviness, weight of my left pelvic half sinking, falling, dropping, and the legs are just so happen that it's attached to my pelvis that is coming along. And it's not about pushing the leg all the way down or stretching and pulling, but more so it's just allowing the weight of the pelvis to gradually shift from right pelvic half to across midline to left pelvic half. And the slowness is part of the process. The rhythm of movement is as important because you're allowing bit by bit of the tissue around the pelvis, lower back to respond to each breath. Yeah. Mm-hmm. And as you continue to rock from side to side slowly, noticing that this difference in sensation between one side and the other is the location of the sensation we talked about earlier. So is the location of the sensation on the surface? Does it go deeper? Is it higher up along the mid-back? Or whether it's right down near the hip joint and lower back. So the location of it and how deep. Is it more on the surface, more grosser layer of the tissue and muscle that is feeling restricted, or sensation of stretch? That's probably wherever there's a sensation of stretch, that's the bundle of tissue that it's tight. So notice the location of the sensation and how you would describe that sensation, whether it's breathable, or are you feeling a strain in the position or movement, which is then to be avoided. It's about no pain, no pain. It's not no pain, no gain, but really no pain, no pain. And if there are a particular side, when you allow your legs to windscreen wiper to one side, and if staying there for a few more breaths is helpful, then feel free to hang out there for a few more moments, few more breaths of releasing some elongation of the tissue, not just on the surface of the muscle, but also visualize deeper layers, deeper along the waist, inside the lower back. And of course, you can continue dynamically moving or to hold and stay in a position. Again, this is a simple practice on its own that you can do for a couple of minutes anytime during the day. Especially if you have been sitting all day for work, computer work at home and things now. Just take 2-minute break and just lie down and do your wiper legs, windscreen wiper legs movement, or the stretch, the first stretch. So just taking your time to transition now, coming back, just returning to the middle. Carefully roll over to your side to sit. I highly recommend especially to protect the back, to roll over to your side to transition to sitting instead of just sitting up like a sit-up position. It's most vulnerable for the lower back and your neck to just bolt right up to sitting from a horizontal position, especially after releasing and dismantling tension and tightness along the back. How are we doing? Good, good. Are you ready for your third position? Which again, like I said, I'm offering 3 just as a selection for you to, so that it's more accessible for everyone. But also it can be independently practiced. So you can just do one of it whenever, wherever you find accessible and convenient for practice. And we'll check in again. I know there are a couple of questions. We'll check in again in a moment towards the end once I show the third and final position. Hopefully after that you'll still come back to the screen and engage with me. So the third position, I'm using a sofa here. You can use the edge of your bed. You can also literally use a table, a dining table or something. But more importantly, it's right where I fold my hips, like right here where I fold my hips. That's probably where I'm gonna have against the edge of the sofa. So if you have a dining table which is quite high, Same thing, you're gonna fold and put your whole body onto the table with a little bit of tiptoes so they can really get onto the table with the whole pelvis, pubic bone, body on the table. Of course, if you're using a table, then have extra padding and cushioning so that it's not like kind of pressing on your face or your jaw or your chin. But here I have a kind of Ottoman stool. It's very specific where you position your pelvis now, so pay attention just for like 1 minute so that you understand how to support your body. So it's not about just folding forwards here, where most of my weight is still on the knees and my pubic bone is not on the sofa yet. So this is not what I meant. I would like the pubic bone and pelvis to be on the sofa, at least at the edge of the sofa. And when I rest my upper body, the head get turned to one side, whichever side. The knees are just about touching, if not hardly any weight. You can see my knees are just about grazing the floor. If anything, I might just lengthen the legs behind me so that there's hardly, barely any. It's just about touching, my knees touching the floor. And arms can either be on either side, depending on the sofa you have, or even just here or here. Just so that it has a bit more opening across the back, allow gravity to do most of the work. Hardly any weight. Now here, most of the weight will be on my knees, right? So same thing if you're using the table, you have to tiptoe a little bit to get your pelvis onto before you a little bit suspend your legs, your knees, your feet. And you can just rest there. So in this position, whilst you're resting here, I'll continue explaining and talking a little bit more about this position. Continue to breathe and palpate so that the spine responds in a wave-like movement. It's a very tiny movement, but there's almost like a oscillation of the spine as you continue to breathe, being in this prone position. So that the spine could articulate, palpate with every in-breath and out-breath. There may be sensation of stretch or elongation. Try to modulate it so that it's not intense, but breathable. So if you're feeling quite a strong stretch or pull, can you reduce and back off a little bit so that it's still breathable? And we're negotiating the texture of the tissue along either side of the spine, around and across the back body, the layers of your postural muscles. Of course, if you have turned your head to one side, take your time to also rotate and turn your head to the other side, or you can simply rest your forehead on folded palms in a neutral position. And the weight of your legs or your knees, your thighs, suggest a direction of release or traction. Offer this sense of heaviness, therefore traction along the spine, along the back. And it's really in the palpation that tension along the back gradually reorganize to modulate how little engagement. So it's not so much about the stretching and the pulling, but about the breathability so that it's a little bit more responsive in the texture of the tissue along the spine. So you can try this on, like I said, on a sofa, on your bed, on a table, as long as most of the weight of your pelvis and your upper body is on the support surface, and it's really just the legs that's kind of hanging off, dangling off, and you might need to modulate how intense is that stretch. It really depends on the tightness at the moment in your back or on that day, which you can modulate and adjust how much, how little. Okay. So a few more breaths here, then we're going to come back and have a little bit of a Q&A before we finish. Yeah, thank you. So relaxing for the back. So Catherine was saying forward bend from the hips exercises. Yeah. Feeling taller. Not just breathing with the asana, but awareness of the pose or movement, maintaining breathability. Yes, breathability is sustainability. So I have a question here, probably relating to scoliosis, whether to put padding for the concavity. It really depends on the orientation. So it depends on the orientation. You might put support under the convexity or concavity. So I'll need to probably understand a little bit more before I have a more specific answer to that. Okay, are you ready to come back? Question was relating to the first stretch. Oh, okay, so when you're lying on your back with your feet against the wall, the first position. If it also depends whether it's in the thoracic or lumbar spine, that if I level my soles on the feet into the wall, I fall into the concavity. Is it the thoracic spine or the lumbar spine? Is it the upper back or lower back? Is it an S curve, double curve? So there are quite a few more. I might take this question later privately. So if you could send me a message separately, then we can have a conversation more specifically to your question. But for now, I'd like to really just focus and also take a question on how was the guided practice, the 3 simple accessible positions that is intended to release and modulate uneven engagement, tension in the body, especially along the back, along either side of the spine, the tissue. I felt discomfort in the front of my hips during the feet against the wall, to lie against the wall, okay, to lie prone with the pelvis supported, help relieve the tension and tightness in the psoas muscle. Yes, so the first statement about discomfort in the front of the hip when the feet is against the wall, lying on the back, so that's the first position we did. If that's the case, I would move a little bit more, let it away from the wall, give a little bit more space to fold the pelvis, fold the hips, like fold the thigh to the pelvis. Yeah. So give it a little bit more space before. Eventually, you can try going a little bit closer to the wall. But for now, when you feel a restriction or knotted up area, especially inside and in the front of the hip, then I would move away from the wall a little bit so that it has more breathability into the lower back and around and inside the hips. And then we can slowly work with it's probably, I'm guessing, is the hip flexors. So just work with palpating, releasing the hip flexors, psoas muscles. Yeah, which in the this last position, prone, you're noticing that it relieves the tension and tightness in the psoas muscle. So I would probably choose this one over the other one, the third position over the first one for now, and until the lower back feels a little bit more breathable with a little bit of mobility. Use the second pose where we do the windscreen wiper leg for a little bit more mobility in the hips before you do more flexion. Yeah. Thank you, Ali, for your question. Discomfort in the first position, as if the lower back stretches too much. It helps to stretch up the leg. Yeah, okay. So Marina, if that's the case, again, same thing. You can move a little bit away from the wall to start. So you can modulate the stretch, modulate, so that most important thing you can remember about releasing, alleviating tension and discomfort in the back is breathability. If it's to a point of stretch or pull that is unbreathable, then we'll have to reduce the range of movement or reposition it slightly in order to make it negotiable. So the key is negotiating the tension tightness rather than yanking and pulling and overstretching and straining. Yeah. So that, hopefully that helps. Second movement was painful on the SI joint hips. Okay, so the wiper leg movement, I understand that with SI joint discomfort, I mentioned also earlier that it's important for stability more than mobility. So the second position, I was encouraging a little bit more mobility in the hip and loosening in the hip and lower back and releasing. So that might not be most appropriate immediately. You can still try it, but maybe do half the range instead of the legs falling all the way to one side. You can do it only a little excursion of couple of degrees off to one side and the other side, and maybe even to take your feet narrower. So feet hip width, if not feet hip width rather than wider than hip width. So because I suggested earlier also with feet wider than hip width earlier. Yeah. So just bringing it a little bit closer. And yes, the last movement, the one that's prone, yeah, help release tension in the lower back muscles, to release weight on the pelvis. This position, essentially, it's the prone release position, is essentially one of the restorative position that I offer, and also a variation of Shavasana that is potentially you could stay for rest in that position with bolster support and all. I actually did post this some time ago, but I will post it again on my Instagram today or tomorrow, and you'll have a photo of it to see it if it's on two bolster, how it's being organized and arranged for releasing the back prone in a prone position. So I'll yeah, if you're not connected with me yet, you can connect with me on Instagram, on Facebook, and for my contact list, so that you can receive some information and mainly yoga inspiration to share some of my reflection and practices with you. Yeah, narrower feet, that's it, Stephanie, that's right. Yeah. So any other questions, comments? I will be hosting some two practice taster session and info session for the Yoga for Scoliosis program, which I'll launch in June. And the taster session will be 45 minutes to answer some scoliosis specific question or any asymmetry imbalances along the back and all. And that will be on the 18th of May. That's the first session. More information is on my website, so you can take a look. I will be putting up the details about the program soon. Result of more walking. Yeah, so again, with also with SI joint discomfort, even the walking stride will need to be a little bit smaller stride than like a big stride. So just modulate. So remember, stability, not mobility, when it comes to SI joint There's actually, when I talk about the scoliosis program, is actually open to anyone who is interested in back care and all. It's a whole, there are 10 modules although, but one of the modules specifically, we look at pain, sensation, some of what we have discussed here, but more in-depth and more practices. So if anyone is interested, then do drop me a message so that I can keep you in the loop when it's open, when there are dates for it. Thank you. Thank you everyone for your participation. I'm very happy to be here to be sharing this with you. I've been longing to share this. Namaste. Enjoy the rest of your day, rest of your week. If you'd like to know more about the online course, so the courses will be online, at least for the Yoga for Scoliosis program. There are 10 modules, and I'll be putting up the information this week. So it'll be the next few days. Just give me a few more days, and I'll put more information on my website. Again, do connect with me, and then I'll let you know when things are up and running. It's a learning curve. Thank you, Marina, Fiona, those of you who just joined me. Enjoy the rest of your day. Namaste.